Hey everyone, Dr. Rob here. I want to take a moment to spotlight my sponsors, Professional Co-op, empowering clinicians with premium access to top-tier lab services at a fraction of the cost. Since 2001, Professional Co-op has redefined what efficient, patient-centered support should look like. No hidden fees, no minimums, and you only pay for completed tests. It's lab access made simple, transparent, and affordable. Trusted by licensed healthcare professionals across the country, Professional Co-op is your strategic partner in delivering high-quality care. Discover more at www.professionalco-op.com. A quick shout out to my other sponsor, Functional Medicine University, one of the top online programs for learning functional medicine. Founded by Dr. Ron Grisanti, FMU has trained thousands of healthcare professionals in over 50 states and over 68 countries. It's completely online, self-paced, and CE approved for a wide range of clinicians, MDs, DCs, NDs, PAs, and more. At the end of the program, you earn your certified functional medicine practitioner credential, something that's truly elevated my clinical approach. If you're ready to level up your practice with evidence-based root cause care, FMU is the place to start. Check them out at functionalmedicineuniversity.com. Hey everybody, Dr. Rob Silverman here, Proven Health Alternatives. I've got a superstar in the area of iron deficiency and iron overload, Dr. Christy Sutton. Dr. Sutton, how are you today?
I'm great. Thank you for having me here.
Oh, I'm excited. As we were talking off camera, here's your book. Let's go right out. The Iron Curse. Wow. Great read, 600 references. I do a lot of blood labs, and the first thing I realized was I don't know enough about iron. Number two, after reading your book, I learned a lot about iron because you argued that iron imbalance, particularly unrecognized iron overload, is a silent epidemic wreaking havoc on health. The interesting thing was that it's not just iron deficiency, it's iron overload. Take the football and run for a first down. Let's go.
Okay, so iron is this extremely important topic for our health, yet all of the cells need it. We need it for energy. We need it for our brain. We need it for life. And yet, most people are not in a healthy level of iron. Their range for iron that they have is not a healthy level. And that's largely because it's overlooked by clinicians.
Yes.
And clinicians that are running the labs, either the labs are not being run properly or they're being dismissed because the ranges are really kind of outdated. When you get a range for a lab, for an iron related lab, it goes off a bell curve. And that bell curve comes from taking thousands of people and looking at their lab ranges and saying, okay, this is kind of the range, and we got the median here. The problem with that is that if you get thousands of people, then the reality is that most of those people are not in a healthy range and they're likely sick or have some underlying problem where they're not in a healthy range for iron. You could do the same thing for, blood sugar. And so the more important thing is to look at, okay, if we take thousands of healthy people, women and men, and look at the range that they should be in, then that's a completely different number. That's more of a functional range. And most clinicians are not even running these important labs to identify when people are too low or too high. And then they often get dismissed or just not mentioned or overlooked, or poor advice is given, which doesn't align with the reality of what the patient needs and is going through. So, and the nice thing about this topic is that these are not like exotic labs that are expensive to run. These are easy to run, inexpensive labs that, and for issues that are largely easy to fix, and you just have to properly identify it and diagnose it and treat it, which is I think this is one of the most overlooked and missed opportunities in healthcare right now.
I agree. I
And
agree.
it's a small dollar topic that if you fix it could have huge gains in healthcare in the long run.
I agree with you. So to extrapolate, um, bottom line is the ranges that we're seeing that are deemed normal are based on normal ranges for unhealthy people. We've got to get ranges based on healthy people.
Right.
So for men and women, and of course, healthy people in ranges in different stages of their life, correct? So a 20-year-old girl is going to be different than a 60-year-old woman who's already gone through menopause. Men is going to be different than women, etc.
Right.
You
But yeah, I mean, the functional ranges, you can still kind of have the functional range for where somebody should be. But at the end of the day, you have to keep in mind, like, maybe a pregnant woman is not going to be able to get in that same functional range as like a 50-year-old man. But we can still aim for that functional range rather than just saying, well, you're in an okay range.
so, which begs the question, what are the appropriate ranges?
Yeah. So multiple important labs to look at. But for iron levels, the most important labs to look at are a ferritin and iron saturation, and then you need to get a CBC, which will give you your red blood cells and hemoglobin and hematocrit. And the two ranges that I have like the most to say about are the ferritin and the iron saturation. So ferritin is number one. Ferritin can get high when your iron levels are too high. It's also an acute phase reactant, so it can get high with inflammation, with cancer, with infections, which cause inflammation. Which is why we have to also look at the iron saturation and the CBC to kind of know what's going on. But ferritin can get low when you don't have enough iron. So, really, the range for ferritin, I don't ever like ferritin to be over 100.
Mm,
And ideally, I like it more like in that 50 to 100 range. 75 is kind of like a nice sweet spot. But the reality is that these things are going to change a little bit with everybody in their life and from person to person. So, but if we're really kind of trying to get into a very acute or a real functional range, then I think that 50 to 100 is a good place.
great.
Um, and in my opinion, and there is some research to back this up, my opinion, once you're over 100 on that ferritin, then you need to get checked for the hemochromatosis genes because so often, especially in women, if you get that ferritin over 100, then they likely have a hemochromatosis gene. And then now they're more likely to get high into the 200s, 300s, 400s, 500s, 600s. And there was a good study where they showed that when ferritin was, they looked at 200 to 600 range, and the people who had a ferritin over 600 were more likely to die of all-cause mortality 2 decades before the people with ferritin of 200.
Wow.
Okay. So that's like huge. That's heart attacks, cancer, everything. So this one stupid marker that's like $10 to run, and
Mm,
most doctors are not running. I see this all the time. People that they've been diagnosed with cardiovascular disease and liver problems, and their underlying problem is that they have too much iron, and the doctor's just not ordering the ferritin, or they're just kind of dismissing it. So ferritin's really important, and I like that range, 50 to 100. I don't like people to go over 100, even men, although I'm a little bit more tolerant about men being slightly over 100 just to kind of be realistic. But there is also research in my book that I think is really important that shows that if you have a ferritin over 100, you're more likely to die of you either die from COVID or get long COVID. So, because iron is important for infections and is like kind of fertilizer for infections, and your immune system can get suppressed by having too much iron.
that's a great point because having written the book Immune Reboot, everybody knows I have a long COVID protocol. People didn't realize that ferritin was elevated in many instances of long COVID. Now, I'm going to play the devil's advocate. I'm going to play the consumer going to the doctor's advocate. Is only low, and it's a woman's problem. It doesn't happen to men.
Okay.
And women never get too much iron stored, i.e., ferritin. Would you like to tackle that one for us?
Yeah, so I would call those myths that are not based in reality. Now, myths are often in existence because there is some level of truth behind them. Because if you look at the majority of women and the majority of men, then those statements could be true for the majority of people. But this idea that it never happens is a dangerous idea. So most women are lower in iron than men. However, women, especially women with the hemochromatosis gene, one or two genes, are still at a high risk for developing too much iron, hemochromatosis, iron overload, and that can happen at any point of their life. My colleague, her 5-year-old daughter, we diagnosed her 5-year-old daughter with hereditary hemochromatosis, and it was causing a lot of neurological problems, severe neurological problems. And they only got better once that iron was brought down. And I talk about that story in the book, and it's
Mhm.
like a very unbelievable story, truly. But her daughter, who's 5, once her daughter starts menstruating, her risk for having too much iron is going to come down. But still, if you have those hemochromatosis genes as a female or a male, then you can go too high. And the reason that women are typically lower in iron is because of menstruation and childbirth, because those two things are huge iron drains, and they are relentless, and they go on for, it feels like, forever for women as far as the menstruation. And menstruation can vary so much from one woman to the other, as far as like how much iron and blood they're losing. Because if you have a really heavy period, you can just lose, a ton of iron, whereas if you have a really light one, then you don't lose very much. So menstruation, childbirth are key. Now, men typically, they're gonna be higher in iron. That's just, if you take 1,000 men, they're gonna be higher in iron than 1,000 women. Having said that, there are men out there that are low in iron. And and that's the situation where you need to really do some digging, because you can't just write it off as menstruation and childbirth. You know, Now you need to say, okay, what's going on here? Always look at the diet. Is this person a vegetarian or a vegan? Are they not getting, an adequate amount of absorbable iron in their diet that could contribute to low iron? Are they on an acid reducing drug, which will decrease iron absorption and everything else? Do they just have low acid because of stress or whatever, autoimmune disease? Do they have an ulcer? Are they bleeding? Do they have a GI bleed? These are common things that can cause men and women to get low in iron. They just often go unchecked or undiagnosed, period, but especially for men, because it's harder for men to get low in iron than women because they're not menstruating. So if I see a man that's low in iron, I'm like, oh, we need to do some digging here.
Mm.
Um, and I think it's always good to get those hemochromatosis genes, because sometimes I'll see a man that's low in iron that has a hemochromatosis gene, and I'm like, oh no, 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 this is not statistically likely to happen. There's something off here.
So that's a warning sign. Low iron in the man is a warning sign of portending some sort of other health conditions, because you're basing everything like I do on root cause, which now I'd like to refer to as root causes
Mhm.
resolution. So low or high iron could be a root cause of something.
Well, I would say the lower
Wow.
high iron can be the root cause, but it can also be the symptom. So, like, the root
Right.
cause could be like malabsorption, like you're not absorbing iron, or it could be a hemochromatosis gene, or there are some genes that can make you low in iron. Like, what is the root cause? Is like, how far deep do you want to get on this root cause? But the low iron can be the cause of health problems, lots of health problems, focus. Low iron can cause focus issues, lower IQ, and just a lot of different things. Whereas it can also just be not just the symptom, but the root cause of various other problems. So regardless, we
So
got to be checking it.
I'm going to talk about symptoms are deceptively diverse in that high iron may manifest as fatigue, joint pain, depression, heart disease, diabetes, even Alzheimer's type symptoms, and many more. So we have certain symptoms of low iron and high iron. So there's still many myths, like you said, and you're trying to dispel the myths. Now you keep
Mhm.
using the term hemochromatosis.
Mhm.
So that means too much stored iron, correct? And you talk about the genes. Now, I've
Mhm.
got the genes written down. I know you have them committed to your heart, but I think the overall idea is there's three genes, and people maybe test for one or two and they don't test for all three. And therein lies the rub.
Or they just don't test for any.
Mm.
Most people are not getting tested for these genes. And okay, so you live in New York.
Mhm.
Okay, so New York has a lot of immigrants that came from Ireland and Europe. And the Northern European, especially the United Kingdom and Ireland, that population is where these hemochromatosis genes originated. And so, like the Irish potato famine, that caused 1 million people to leave Ireland.
Mm.
Okay. I can't remember the exact number of people that died there. I think it was 1 million people died in Ireland during that famine. And then 1 million people left Ireland because of that famine. And a lot of them came to America, came to New York. Okay, so there are a lot of hemochromatosis genes in America, especially in populations that are Caucasian and have, Irish last names or United Kingdom last names. This is a red flag. Like, look at people's last names, look at the color of their skin. And you can see, are these people at a higher risk for hemochromatosis or not? But most people are not looking for these genes. The advent of these direct to consumer genetic testing companies has really been pivotal in allowing people to get this information without using a doctor. And for that reason, more people are getting these genes tested, but they still don't understand what they mean. Okay.
Right.
Um, and that's not really how the system should work. Like, you shouldn't have to go outside of your doctor. It's okay to do that, and it's necessary often. But the reality is that, like, the medical system needs to do a better job, not
Agreed.
just here, but even like if you look at the United Kingdom, so their medical system should be checking everybody for the hemochromatosis genes. They have the highest rate of the hemochromatosis genes in the world. 65% of the Irish population has one or more hemochromatosis gene. They should be checking everybody at birth for these genes, but they're not. And so what they're getting instead is they're getting people that get end-stage liver cancer,
Terrible.
or bipolar, or depression, or joint pain, or diabetes. You name it, it can cause all these issues. It can kill you literally, because iron, if you get too much iron in your body, then it's toxic, and your body doesn't have a lot of ways to remove that iron other than blood loss. So you build it up and it becomes toxic and it'll kill you.
Let's take the next step into the genes. What do the genes mean? Meaning homozygous, heterozygous, stuff like that. Let's geek out. All right. So everybody,
Yeah.
spoiler alert, we're gonna go geek on everybody now. Go for it, Doc.
Okay,
So
so that's great. Not a lot of people are willing to ask me to like ask these really detailed questions, so that's great. Thank you. So there's three hemochromatosis genes. Okay, so they all start with HFE, and
mhm.
then there's the C282Y, which is the most intense of the three. Like, that's the most likely to cause you to have hemochromatosis, because that causes you to absorb more iron than the other two. So the C282Y is like, I call it the heavyweight. It's like the heavyweight champion gene. And you can get one of those from one of your parents, and or you can get two, one from each parent. So you're going to get one from each parent. Either you're going to get like a normal gene where you are not at a high risk for hemochromatosis, or you're going to get a hemochromatosis gene. And the C282Y is the heavyweight champion. If you get one of those, you're at a higher risk for hemochromatosis. If you get two, you're at a very, very high risk for developing hereditary hemochromatosis, which is where you have too much iron. There is this myth that if you get one gene, that means you're heterozygous, then you are not at a risk for hemochromatosis. You're just a carrier. And I call that the carrier myth. And
Mm.
it's a serious problem in healthcare right now, because there's a lot of doctors that were erroneously taught that if you have one hemochromatosis gene, you're safe, you're just a carrier. And then their patients, they dismiss the patients as being safe because they're carriers. And that is not doing a service to anybody. These people are getting completely dismissed and missed. So, but if you have one hemochromatosis gene, you're heterozygous. If you have two, you're homozygous. Okay. Now, the C282Y is the heavyweight champion. The middleweight champion
Mhm.
is the H63D. So you can have, one or two of those, Those genes are the most common of all hemochromatosis genes, the H63D. The most common, they're the most common because they're the oldest. They originated the oldest in evolution. And they also originated on like the landmass of the Northern European area, probably like around Spain or so. And because they originated on a landmass rather than like an island, like the United Kingdom islands, which the C282Y are more like from the islands of the United Kingdom, most likely, the the H63D was on a landmass, so people were allowed to migrate throughout Europe and even into like Asia and the Middle East. And for that reason, those genes are the most common. And you will see them some in the Middle East, much more so than the C282Y. But having the H63D one or two will increase your risk for hemochromatosis, especially if you have two. One is not as bad of a risk, but it can cause it. Like my daughter, for example, she's 11. She has one H63D that she inherited from my husband. And she actually, she's 11. She's growing really fast. She's exercising a lot. So she actually needs iron. Like I'm giving her iron because when I checked her ferritin, it was lower than I wanted it to be. And so I'm giving her iron, but I'm watching her levels because I know that, she could go too high. It's not a super high risk with that genotype, but it can happen. Now, as she gets older, then it's more likely to happen. So, and then the third gene is HFES65C. And we don't know quite as much about that gene as the other two because it's newer as far as being included in the hemochromatosis genes. It's thought to be much rarer, although I think we need to do more research to really get a clearer idea because most of the studies were not looking at that gene as far as where it is in the world. So I think we just need to know, okay, this is a hemochromatosis gene. It's not as high of a risk as the other two. It's like the lightweight champion because it increases iron absorption, but not as much as the other two. So, but you can get one or two of those. You could be heterozygous or homozygous. The last thing I want to kind of say here before people lose their attention on me geeking out is you can get one of like the heavyweight champion and one of the lightweight champion, or one of the middleweight champion and one of the heavyweight champion. It can be any of those combinations. So you could get one or you can get two. And if you get two, it can be the C282Y and the HF63D, or it can be the HF63D and the S65C. So middleweight, lightweight. And those people that get one of two different champion categories, they're called compound heterozygotes. So they're heterozygous from two different genes types.
It has been said
Mhm.
that about 25% of our outcome is based on our genes. Genes are not your destiny. The environment loads the gun. The genes load the gun, excuse me. The environment fires the gun.
Mhm.
How does that pertain to just what we talked about with the genetic mutations?
Yeah, so I think that's a really good question. It's huge as far as there are very few genes that actually cause diseases, like period, 100%. Most of the time it's like it can increase your risk or decrease your risk. Um, the main genotype that is at a very, very high risk for hemochromatosis is the homozygous
The
2C282Y.
heavyweight.
They almost always are going to develop. Yeah, if you have two heavyweight champions, they almost always develop hemochromatosis. However, not always, because environment plays a role. So, like for example, I have a patient that has two C282Y genes. She is low in iron for environmental reasons. Okay, so you have to look at the environmental factors because the genotypes, all they do is they increase your iron absorption or they decrease your iron absorption. But if there's no iron to absorb, or because you're just not consuming it, or you're not absorbing it, or you're just losing so much blood for one reason or another, then you can still be low regardless of your genotypes. In fact, the reason that these genes are so common, and they are very common, is because iron deficient anemia has killed so many people in the past that these genes
Wow.
were like evolution's answer to that. And if they were not helping us to be able to have more babies, which is really the bottleneck that evolution works through, then they would not exist. But women dying of iron deficient anemia leading up to their childbearing years or during pregnancy or during delivery due to blood loss or malabsorption or whatever is a huge evolutionary bottleneck that has killed lots and lots of women. And these genes protected people from dying of low iron. And that's why they exist so much today. Um, it's just now we live in a different world. Now we live in a world where foods are fortified with iron, and you can go to McDonald's and you can get, iron rich beef, which is a great source of natural iron. And people are living longer. So it used to be like if you lived to your 40s, you were like an elder, now and
Right.
now people are living older, and so they have more time to collect more iron. They're living into post-menopause. So
Yeah.
now we're not menstruating anymore. So now we're more likely to get high in iron. Now we have, vitamins. A lot of people that are taking iron and they shouldn't be. A lot of people that should be taking iron and they're not. So the genes are part of it, but they're not the whole story. Now, some people will have genes where they're more likely to be low in iron, or they don't have a hemochromatosis gene at all, and they're higher in iron because maybe they're on like a carnivore diet. Or I see this a lot these days, people that are on a carnivore diet and they have the hemochromatosis gene and they don't know it, and they have undiagnosed iron overload, and they just traded one health problem for another unintentionally.
Now you can get these tests, a specialized functional medicine test is not something typical that somebody can ask for at LabCorp or Quest, correct?
We're talking about the genes.
Right, the gene
Oh,
test.
this is such a good question. Thank you for asking that. Okay, so most of the patients that I've diagnosed with hereditary hemochromatosis, I am getting it through their 23andMe data. Okay.
Excellent.
And I'll run their or other genetic tests. I don't care if it's 23 or not, 23andMe or not. 23andMe is the main one that people have done. And so that's just the one I'm referencing. And so 23andMe will sequence all three of the hemochromatosis genes at this point in time, but they only tell you about the two main ones, the heavyweight and the middleweight champion. They often they don't tell you, they sequence the lightweight, but they don't tell you about it. Sometimes they don't sequence it, but they've gotten back to where they sequence it again. And so then I'll take that raw data from 23andMe and I'll run it through the genetic detoxification report, which is the report that I created. And that'll give you all three hemochromatosis genes, and it'll give you like MTHFR and on methylation and all these other
Mm.
things. And even if you did the ancestry only 23andMe, you can still get health information by running that report. So most of the people that I am getting genetic information from is from like direct to consumer 23andMe. That's actually how I diagnosed my husband with the hemochromatosis gene. When I was writing my first book, I realized like, oh,
Wow.
this is why my husband has high iron and I keep telling him to donate blood. And he has this hemochromatosis gene. And like, okay, I'm reading about this, I'm writing about it, I'm learning about it. And why is this doctor not? What's going on here? So the hemochromatosis genes are available through Quest and LabCorp, but I'm so glad you asked this question. Do not run the hemochromatosis genes through Quest at this time. Run them through LabCorp because Quest only sequences the two hemochromatosis genes. LabCorp sequences all three. Having said that, if I order the hemochromatosis genes for my patients, granted, I have a cash only practice, even with a discounted lab company, it costs them almost $400 to do those three genes. Where if they can go to like 23andMe and get a $100 ancestry kit and run it through genetic detoxification for $30, now I just got those three hemochromatosis genes plus so much more for $130. Does that make sense?
It makes a lot of sense. And, in a world where insurance does not cover anything, it's just insurance, so you don't go broke per se. That's a
Mm-hmm.
great takeaway. Now, you alluded to your husband. I read your book and we talked about it before. So let's have full disclosure. You found
Yeah,
out something about your husband. Well, I'll say you found out something about your husband's health that no other doctor did. And that really is what's started the wheels, turning for, taking the next step into the iron curse and
yeah,
really delving in. And it just really exemplifies how so many people in our world, if you will, this functional medicine, functional nutrition world, it's something that happened to themselves, a family member, I mean, a patient. It's a life-changing event. So if you could you fill in some of the details on why
of
iron
course.
became your thing?
Yeah, why I'm now called the Iron Queen by some people. Yes. So that story, personally, iron was on my radar before my husband because I really the story starts with me having Crohn's, celiac, part of my intestines removed, and complicated reasons for having to really watch my iron levels, and because I tend to be low in iron, and for me it's like I'm fighting this battle to be higher, and like I can't wait until my menstrual cycle is gone because it's just making that battle harder. So iron was on my radar as soon as I got out of practice. I noticed when I got out of when I started practicing, when I got out of school, like occasionally I'd see somebody with a high ferritin, and I was like, I don't really know what to do other than go donate blood. And I didn't really dig into it and ask, do you have the genes or even know about the genes? But then I got married, and my husband brought home some lab tests that showed that he had high ferritin, high liver enzymes, high red blood cells, high hemoglobin, high iron, all these things that like were red flags to me, like, oh, this is bad. And I think, you need to donate blood because your iron's too high and it's messing up your liver, because one of the organs that's most sensitive to iron damage is the liver. In fact, it's not only often the first damage, but it's tremendous increased risk for liver cancer in people with undiagnosed hemochromatosis, like 200 times increased risk. So it's really important to pay attention to those liver enzymes as a red flag. So I would tell my husband to donate blood, and he would periodically do it. And then he just kind of stopped listening to me as much the further we got into our marriage, just because, that's what happens, I think, sometimes in marriage. And so then I start writing my new book, my first book. I started writing my first book, the blue one, the genetic testing, defining your path to a personalized health plan book. And I'm writing that book, and I learn about the hemochromatosis genes as an important gene to include in there. And I realize, and I realize my husband has one. And then I'm like, oh, this is why my husband has all these problems with needing to donate blood and high red blood cells and hemoglobin and hematocrit and ferritin and iron and liver enzymes. And so his doctor that is ordering these labs is not saying anything about it. They're not saying anything. They're just ordering the labs and giving them to him, and everything's fine. Um, and then finally we go to the gastroenterologist because now he's had like a prolonged period of his liver enzymes being slightly high. We go to the gastroenterologist without the referral from his PCP. We just decide we need to get another opinion. And so we go to the gastroenterologist, and I give the gastroenterologist like the full workup. Here are the labs I've been running on my husband that show the problems. Here are the labs that his doctor was running that show the problems. Here are his genes. And I just, I think that the iron is causing the liver problem. And the gastroenterologist kind of listens to me and then goes through their normal steps. And the steps they take are they do like an ultrasound, and they say, okay, mild fatty liver, you're a little bit overweight, you need to lose some weight, and drink less. And he wasn't really drinking, and he wasn't really eating a lot of sugar or anything. And then he said, and then they ran this test that checked for autoimmune hepatitis, which is where your immune system attacks your liver and destroys your liver. And that came back positive. And so we kind of go on this red herring where we go down this rabbit hole, and it was actually a misdiagnosis. And so the gastroenterologist said, you need to take this drug for a year, and then your antibodies to your liver will go away, and we'll recheck it in a year. And I'm like, okay, this doesn't make sense. Why would we wait a year? So then a couple of months after being on that drug, I recheck the liver enzymes. I recheck for the autoimmune hepatitis. I recheck the iron stuff, and the autoimmune hepatitis antibody is gone. His liver enzymes are still high, going higher. The iron levels are getting higher. He still has high red blood cells and hemoglobin hematocrit, which is all common with hemochromatosis. And I send it to the doctor and I say, hey, here's the labs. I rechecked this autoimmune marker and it's negative now. And the doctor says, oh, okay, false positive. It wouldn't go negative that fast. And I'm going to refer you to the hematologist. I think he has polycythemia vera, which is a genetic issue where you make too many red blood cells. So I'm like, okay. So we go to the hemochromatosis and I give them, all the information. And we go to the hematologist. I said we go to the hemochromatosis. My apologies. We go to the hematologist. We give him all the information. And the hematologist is like, hereditary hemochromatosis. That's it. Easy. So then they treat it. Okay, a lot of the stuff gets better. His liver enzymes come down, his iron levels come down, his red blood cells come down, his testosterone comes up a little bit because high iron can cause low testosterone because it damages the testes and the brain and the pituitary gland. And so, but in this, when you're treating like a spouse or like anybody, you kind of take a large breath of tests and you just say, I don't know what's going on. I'm just going to test a lot of things and see what's going on. And so one of the labs that I was running when we were going through this experience was I was running like DHEA and cortisol, and they would be sometimes slightly high and then they'd go back down to normal. And after treating the hemochromatosis, the only things that wouldn't go back to normal was the DHEA and the cortisol, which the hematologist thought were going to go back to normal once the stress of the hemochromatosis was gone. And so then we go to the endocrinologist and, I give the endocrinologist like the full history and everything. And I've kind of wondered about my husband having too high of cortisol and maybe even like a Cushing type issue in the past. And the endocrinologist is like, it's not Cushing's because his blood sugar is normal and he doesn't look like somebody with Cushing's. So, okay. So then 4 months later or whatever, he's like having brain surgery for Cushing's disease because he has a pituitary tumor that's causing him to secrete too much ACTH, causing him to have Cushing's. And so the reason I tell that part of the story is because hemochromatosis damages the pituitary gland and it causes a lot of DNA damage and it can really damage your pituitary gland. There's certain parts of the body that are like high risk for iron, and the pituitary gland is one of them. So I don't think, I don't have a time machine and I can't go back and like prove that the hemochromatosis caused the pituitary gland, but I think it's an important thing to note. I think that my husband, had he had lower iron and higher antioxidant levels, likely wouldn't have that pituitary tumor that caused him to have Cushing's.
Mm.
I also think it's like a cautionary tale of that was a really formative experience for me because I was still a pretty young clinician and I didn't really have, that as much confidence. And going through that experience, I realized like, oh, like I know more than I thought I did, and these people know way less than I thought they did.
I agree that I think that iron is overlooked. It's, considered in many instances just a marker. And I'm really sorry about your husband's plight. Of course, he's really fortunate to have you there. And again, the backdrop to how you became the Iron Queen, as you said, I love that, is a family member, of course. So I'm going to switch gears. I'm going to speed you up now. I warned you. I know you're from Texas. I'm from New York, a couple of big states, but we're going to do it in what we call the rapid fire New York minute. So let's get going. Longevity, the insightful conversation of 2025 has been since February of 2023. Some longevity markers that I usually share: ApoE status, ApoB status, LP little a, C-reactive protein, maybe even RBC. Would you say that it would be fair that Rob should put on his lecture circuit iron and ferritin as longevity blood markers?
Yes, I would do ferritin and iron saturation. Ferritin, I already told you about how a ferritin over 600 increases your risk of, takes 2 decades off of your life versus a ferritin over 200. I told you about how ferritin over 100 increases your risk of long COVID and death from COVID. Um, and if you're doing that ferritin, then you need to add the iron saturation because If your ferritin's high and your iron saturation's high, over 45, then you have hemochromatosis. And now you just diagnose somebody with a condition that is going to decrease their longevity, that's easy to diagnose and easy to treat. So yeah, I would add those two for sure. And that'll probably add like $20 to the whole longevity panel.
That question easily attainable. You made a comment about high iron decreasing testosterone. You can't get away with that with everybody here wanting to take TRT, etc. Can you
Yeah.
give some clarity to that?
Yeah, I'm glad you asked that. Okay, so not only does high iron decrease testosterone by binding to the testes, it iron will go to the testes and the gonads, so it also will cause infertility in women and men by damaging the ovaries and testes. So then you don't make as much testosterone, but high iron will also cause low testosterone and hormone problems in men and women because it damages the pituitary gland and the brain, which are ultimately what control your hormone levels. So why this is important, not only because, low testosterone is bad for your health and longevity, because a lot of men and women are diagnosed with low testosterone. And then the reason they're low in testosterone is because they have too much iron. Okay. And so, but often they'll be given testosterone without having their iron levels checked. And then what happens is when you take testosterone, that'll increase your iron absorption and it'll also help you to make more red blood cells and hemoglobin and hematocrit. And so if you don't diagnose the root cause of the low testosterone, then the treatment for what you diagnosed as low testosterone will make the root cause worse. Does that make sense?
It makes a lot of sense because most of the people go to the doctor and they test just total and free testosterone, do different ratios. They're not looking at blood sugar. They're not looking at doing a detoxification. They're not looking at gut health. They're not looking at iron. Once again, the body's all interconnected. It's a great point. So here's another one for you. I have high iron. I have high ferritin. What food should I avoid?
Well, shellfish are really high in absorbable iron. Beef, red meat is really high in absorbable iron. Um, the foods that it's not as important to avoid iron-rich vegetables because iron-rich vegetables have the non-heme iron, which is not as absorbable. So the top ones would be shellfish and beef and bison. But once your iron levels get normal, then you can add those back. And there's certain supplements you can take, or certain things you can do while you're eating those high-rich foods. Like you could drink green tea or coffee around that meal, which will decrease iron absorption. Or you could take supplements that bind to iron and lower iron, like curcumin or green tea supplements, or, I kind of go through all the supplements that can bind to iron in the book, but that's a couple of them. There's a lot.
Well, I'm happy you mentioned that. I'm an avid coffee drinker. So, for me to recommend to my patients for absorption of iron, do they take the iron supplement in the realm or in the same time frame that they consume their coffee, or do they take it separately?
Separate, yeah. If they take it during or like an hour before the coffee, it can decrease their iron absorption from that iron supplement. If they drink the coffee before, it's not as much of a problem because the coffee's gone through by the time the food's there.
Curcumin, the most active ingredient in turmeric. My understanding is it blocks iron absorption or decreases iron absorption. True or false?
True. So it chelates iron and it's really a valuable tool for decreasing iron absorption. If you use curcumin for inflammation, then you can unintentionally cause low iron. So that's something, you really need to know what supplements are affecting iron, period. But yeah, it not only does it help people to not go high in iron that have a propensity towards going high, but it also will be absorbed and then it'll go and it'll bind to the iron that's stored in your organs and pull that out. Like, because a lot of people, they get hemochromatosis and they get iron stored like in their brain and their liver and their spleen and their pancreas and their joints. And that is harder to treat. But if you take the curcumin and other iron chelators that can go and like bind to it, then you can rescue those organs from that iron overload in the tissues.
Alpha lipoic acid. The only
Yeah.
antioxidant works with the watery and the fat part of the cell.
Yeah.
Tell me its effect on iron.
It binds to iron and lowers iron. Yeah, it's
Yeah.
like curcumin in that regard. But it
And
also has other things, like it's really good for blood sugar and neurons. Yeah.
so iron balance has a very health promoting feature.
Yes. Yes. We didn't even really go into like low iron. Can I just briefly do
Yeah, let's
that?
do it. Let's
Okay.
go.
So low iron
You mean
is,
anemia, low iron, i.e. anemia.
yeah, so low iron can cause iron deficient anemia, but not having enough iron, whether it's, just iron deficiency or iron deficiency with low red blood cells and hemoglobin, which is iron deficient anemia, regardless, like not having enough iron is really a problem for a lot of people, especially women and children. And so, like, about there are studies that have shown that 84% of children with ADHD had a ferritin under 30. And if you gave these children 80 milligrams of iron a day, then it would dramatically improve their symptoms of ADHD and decrease their severity. So there's a lot of kids out there because you need iron to make dopamine. And if you don't have dopamine, you can't focus
Right.
and your brain will not develop. So pregnant women that are low in iron, their babies can have a lower IQ, like significantly lower, like 5 to 16 points lower, just because they were low in iron. And that carries through the rest of their life, okay? Because they didn't have enough iron to make all those dopamine, to make the dopamine, which creates the synapses and builds those neural networks. And if you don't build those neural networks in utero, then you don't have them. Also, you need iron to create myelin sheaths. So um, you cannot have a healthy brain. This is why low iron will cause restless legs and sleep problems and anxiety. You're not getting enough oxygen to your brain, not to mention it'll cause fatigue and, a lot of different issues. And in some ways, the low iron people are almost harder than the higher iron people, often because with higher iron people, it's like, okay, remove blood, diet, supplements, that usually works pretty well, pretty fast. But sometimes these low iron people, it's like they have some really complicated problem that's causing them to be low in iron. Not always, but sometimes, and sometimes they're much harder. But low iron is significant. And I never like ferritin to be below 30. I really ideally like it in that 50 to 75 range.
Yeah, it's funny that we spend so little time on low iron and everybody talks about anemia, and we really spent a lot of time on, hemochromatosis, high iron. So I do want to ask you a few rapid fire questions. My buddy always listens to my podcast in Geneva, and he's like, Rob, I want some tangible things to take away. So here we go. I'll give you in the power of three. You probably said it before, but what three tests should he take when he goes to his primary care physician?
Okay, so ferritin, the iron panel is going to have TIBC, UIBC, serum iron, and iron saturation. So that iron panel is one test. Ferritin is usually ordered separately, so that's all iron related stuff. And then usually they're already doing the CBC, so I'm not going to say that, but you have to have that with your iron labs to know what's going on. So I would say then the next one would be a CRP because anytime that you're looking at ferritin, it's also important to look at CRP because ferritin can go high because of inflammation. So you don't want to be misled by a high ferritin that's inflammatory driven. And if you have that CRP high, then that can explain part of why the ferritin's high at least.
Three best foods for iron balance.
Well, it depends on if you're trying to go higher or lower.
I'll give us both.
Okay, so if you're trying to go lower, then any type of like coffee and green tea, I talked about that.
Mhm.
If you're trying to go lower, calcium-rich foods are great for binding to and lowering iron. And like phytic acid rich foods like oatmeal and stuff, that'll bind to iron and lower it as well. If you're trying to go higher, red meat like beef, bison, shellfish, those are gonna even turkey has a little bit of iron in it, not as much as the beef and bison, but animal products. This is why vegans and vegetarians struggle so much with low iron because there's not enough and not enough absorbable iron in plants.
D3K2, yes or no for iron balance?
I say yes. Some people would say no. Um, so I am just a fan of people having a good D3K2 period, like regardless of if it's iron balance
Mhm,
or
mhm.
autoimmune or whatever. But to me, I see a low D3K2 as like a low-hanging fruit issue that just we can fix this, and this is going to make your body healthier in general while we try to put out these other fires. Um, it doesn't have the strongest effect, I think, in one way or another on the iron per se, but it does have a large effect on inflammation and your immune system. And so many people with high iron have these chronic infections, so they need to have plenty of D3 to protect them, and they have a higher risk for cancer, so they need that as well. I mean, yeah, I just would say as a blanket statement, everybody needs to have healthy, adequate D3K2, regardless of high or low iron.
Gut health and iron. Where's the
Gosh,
correlation?
I could teach a whole class on this. Um, well, high iron will cause leaky gut, can cause food allergies, can cause autoimmune issues, can cause infections. So high iron can really cause a lot of gut problems. Gut problems can cause a lot of low iron issues because of malabsorption or GI bleeds. The gut and iron, if somebody has low iron especially, you have to look at the gut. And if somebody has high iron, then it can really damage the gut as well. So we kind of always have to be looking at the gut, in my opinion.
Exercise's effect on iron levels.
Exercise lowers iron levels. Yeah, it will. Exercise will increase hepcidin. You're using more iron up. Yeah, but increases hepcidin, which decreases iron absorption. So if you exercise a lot, it'll cause lower iron, which is why, I see a lot of professional athletes that have these hemochromatosis genes, because when you exercise a lot, you're at a higher risk for lower levels of iron. And so that hemochromatosis gene helps you to have a little bit of extra iron so you don't get low. And then they ultimately stop exercising when they retire. They don't exercise as intensely. And then they often become, too high in iron because now they're not exercising as much. And so their stores are not going down as
Is
quickly.
that exercise? Is it cardio, weight training, or
Cardio.
just cardio?
Yeah,
So
more
weight training
cardio.
positive for iron levels?
It will decrease iron absorption.
Okay.
So, yeah. But everybody needs to exercise. But if you are exercising and you're low in iron, you're going to have to take more iron so that you don't get lower.
Last thing I want to ask you, what's this thing with iron and vitamin C? I hear about it all the time. Could you
Yeah.
expand on that?
So, vitamin C increases iron absorption. So, if you're trying to increase your iron levels, then take vitamin C with it. If you have high iron, then you need to be careful about not taking vitamin C with iron-rich foods because then you'll absorb more iron with those foods. And then just don't take, people with hemochromatosis need to be careful about overdoing vitamin C. They can usually get away with it. They just need to take it separate from food and not super high dosages, like maybe 1,000 milligrams or something max a day.
You were right. We're going to need a part two because there's still a lot to uncover. So it's been my pleasure. Proven Health Alternatives, the Iron Queen. We did it. Dr. Christy Sutton, Rob Silverman, always yours in health.